Woman gets needle stuck in her bladder after she sticks it up her urethra. Man calmly walks into the ER waiting room saying he has a stabbing pain in his belly, just to find out that he has an actual knife in his belly. My name is Brent Bowen. I've been a nurse for about 1.5 years, and I'm going to talk to you about some of the roles and responsibilities that it takes to become an ER nurse. This is my last semester at Grayson, and I've noticed that there is a lot of students who wish to become nurses. So I'm going to talk about some of the things that nursing has made valuable to me, and then maybe one day those things will become valuable to you if you become a nurse. I'm going to talk about the required schooling, the things you learn in the field, and then the things you learn in the trauma room. So if you're wanting to become a nurse, the first thing you got to do is get your prerequisite courses. According to the Journal of Nursing Education, the required nursing prerequisite courses to be admitted to the nursing program is anatomy and physiology, statistics, and microbiology. Then once you get admitted into either a 2-year program or a 4-year program, you'll finish off your school, and then once you graduate, you'll have to sit for your NCLEX, which is the National Council Licensure Examination. It's 75 to 240 questions, depending on how well you're doing on the test. And then once you pass, you're officially an RN. Now, if you're wanting to go straight into emergency nursing, there's a couple certifications you have to get before you can start as an ER nurse. Those are your basic life support, advanced cardiac life support, pediatric advanced life support, and trauma nursing core course. Now that I've talked about the required education to become an ER nurse, I'm going to talk about the street smarts, the things you learn in the field that nursing school doesn't teach you. According to Mercer University, the ultimate goal of nursing school is to prepare students to make sound clinical judgment to better ensure patient outcomes whenever they're a nurse. There's one thing I learned after I graduated is that nursing school does one thing. It teaches you how to not kill somebody. And then you actually learn how to be a nurse in your first year or so of being a nurse. According to Yalowich et al., ER nurses deal with unpredictable challenges, things like violence, trauma, extreme patient conditions, overcrowding. These are all things that happen every day in the ER, and sometimes they all happen at once. So it's really important to learn how to keep a calm, cool, and collected attitude while you're treating patients who have these really, really bad things going on. Because it happens so often, you have to be able to learn how to cope internally so you can focus on saving that patient. And that's just something that you can't learn in nursing school. You have to experience it day to day, like see these life and death situations commonly to be able to stay calm. Another really important thing that you learn in the field is anticipatory care. This is something that happens whenever the patient comes in and you start treating them before the doctor gives orders. So this would be situations like if a patient came in with abdominal pain. Automatically, as nurses, we know, in the ER at least, that if they have abdominal pain, they're going to get an IV, they're going to get labs drawn, they need a urine sample, and they're probably going to get an ultrasound or a CT. So now that I talked about the book smarts, which is schooling, and the street smarts, which is what you learn in the field, I'm going to talk about my favorite part of nursing, which is trauma. So I work in a level 1 trauma center, so we see all different types of crazy things on a daily basis. According to the Journal of Acute Disease, 34% of trauma patients die within the first 1 to 4 hours of their injury. Now this can be prevented through rapid identification and treatment of these patients. Some of the common traumas that I see at the level 1 I work at is motor vehicle accidents, gunshot wounds, falls, thermal burns, electrical burns, and things like that. An integral part about being an ER nurse is getting your TNCC, or Trauma Nursing Core course. This is a course that teaches you how to properly assess patients who have had trauma happen to them. According to the TNCC manual, assessing a patient with trauma should be done in an organized and systematic fashion. One of the big things they teach you in that class is the A through J mnemonic. They did add a C at the beginning, so it goes C, A, B, C, D, E, F, G, all the way down. I'm not going to say it's super long, but the way it would go is C, controlled bleeding, and then it goes airway, breathing, circulation, deformity, exposure, and then it just continues on. And everything's done in an organized, systematic fashion. Now that I've talked about what it takes to become a nurse in school, and then what it takes to become an ER nurse in clinical judgment wise, and what you have to learn in trauma, I just want to say that becoming a nurse is a big life decision, and it changes your life more than you could ever know until you do it. And if you're considering becoming a nurse, I definitely would say that it has changed my life in a positive way, and it's something I really value, and I can't wait to get to work every day. The roles and responsibilities of an ER nurse are challenging and vast, but if you have a good education and a really great team, you can truly help those in need. Now, I want to close with a saying that I learned right when I got out of school that's kind of stuck with me, and I figured I would share it with you. Always treat the patient as a whole, not just the hole in the patient. Thank you.